All right, let's get the show started. My name is John Kelly. I'm the editor-in-chief of the Chronicle of Social Change. I'm joined here today by our publisher, Daniel Heimpel, to present Family First Act. What's next? We're going to talk all about what's in the act, what we're paying attention to here at the Chronicle as we move towards the October 2019 implementation date for the Family First Prevention Services Act. And then we really want to get quickly to your guys' thoughts and questions. We'll do our level best to get to as many questions as we can during the webinar. We'll also be capturing all these questions and comments for further correspondence as well. So if we don't get to you on the webinar, don't worry. We will definitely be reaching out to everybody that tries to reach out to us during this thing. So a little bit about the Chronicle before we start. We are a nonprofit independent news site covering child welfare, juvenile justice, and other critical systems for serving vulnerable children and families. A little breaking news for our juvenile justice advocates and observers here. The Juvenile Justice Delinquency Prevention Act was reauthorized today after 15 years. So go check out the Chronicle after the webinar to read up on that. We've got our website listed here for you, as well as our Twitter and Facebook handles. You also have my direct line, jkelly@chronicleofsocialchange.org. So what we're going to try and do today is, like I said, get through a brief introduction to the Family First Act, the two big changes that it makes to the Title 4E entitlement, get to 7 of the many things that we at the Chronicle will be paying attention to this year as it pertains to FFPSA. And then, of course, we want to get to you guys and hear what you're hearing out there in the States about implementation, your thoughts, your questions, and all that. So without further ado, let me get right into it. And first, actually, let me just thank everybody for joining us today and for donating to the Chronicle. Let's get going. Family First Act. One of the two big sections of the act is the funds made available through the Title 4 entitlement for the prevention of foster care, of using foster care. Essentially, what is done on the front end by the act is that now states are able to seek reimbursement through the 4E entitlement for various services that would assist them in serving families without resorting to foster care, without using foster care. And what's allowed is 3 different avenues or types of services: substance abuse treatment, mental health treatment, and parenting skills. The eligible groups, and we're going to talk a little bit more about this later, are families where a child is at imminent risk of entering foster care, and pregnant or parenting teens. Second big leg of the Family First Act on the back end of the 4E entitlement is its limitations on federal funds for congregate care. So it sets a limit of 2 weeks on 4E funding for youth who are placed into group homes, institutions, the various placements that are known kind of collectively as foster care. But the law does set some pretty notable exceptions for that, where the 2-week rule does not apply. There would still be some requirements or different procedures that you'd have to go through to continue a placement after the period of time, but there's notable exceptions for housing for extended foster care, kids who are 18 or over, pregnant or parenting teens, youth who are at risk of sex trafficking, and then qualified residential treatment programs. So the third, collective basket of different stuff in the Family First Act, just to go through a couple of them here, are the provisions around the Kinship Navigator program. The Kinship Navigators are programs that try to connect relatives who are taking care of youth, either who have been formally removed into foster care or who are living with relatives in another scenario, trying to connect them to services and resources out there in the community that they'll be eligible for. Daniel's going to talk a little bit more about KIN later on the webinar. It sets a longer timeline for reunification services under another part of federal funding, the Title 4B. Currently, there's a 12-month clock on that. That goes to limitless. Essentially, there's no timeline for reunification services to be rendered. And then It also adds 15 months of eligibility for reunification services after a child has come home. So you don't have to just basically cut those off once the child has been removed. It also calls on HHS, the Department of Health and Human Services, to build a national model for licensing foster homes. That process is already in the works. They have promulgated that and asked for feedback, and I think that's where that stands. Excuse me. It extends the runway a little bit on eligibility for Chafee independent living and college assistance. And it requires states to start doing reviews of maltreatment fatalities. So that was just a quick overview. On this page here, we wanted to just link back to a few pieces that we've done that would be helpful if you want a little bit more detail on what I just kind of breezed by. Our little Cliff Notes collection on the 3 different parts, as well as Daniel's excellent story on how this all came to be after several pushes through Congress as part of a federal spending bill to prevent a shutdown in February of 2018. And then if you go to the bottom link there, you can see all of our regular coverage of Family First Act. It's all tagged as finance reform and Family First Act, so you'll be able to access it there. So I want to go through a few of the things that we're going to be taking a look at as we move towards, like I said, the October deadline by which states are expected to comply with the Family First Act, with, of course, the notable caveat there that states are allowed to seek up to 2-year delay on the congregate care limitations. And if they do that and obtain a delay, would not be able to draw down money using the foster care prevention services on the front end. So question number 1, what does it mean to be a candidate for foster care? Because this is a critical piece of the eligibility puzzle in terms of what families are going to be served on the front end of Family First. This is the basic definition we put in here that was shared with people through the program instruction that the Department of Health and Human Services put out recently. I'll just read it quickly. A child who's identified as a Title 4E prevention in the 4E prevention plan as being at imminent risk of entering foster care, but who can remain safely in the child's home or in a kinship placement as long as the Title 4E prevention services are necessary to prevent the entry of the child into foster care are provided. Now, that is a mouthful. And essentially what it says is that there is some determination that a child is at risk of entering foster care, but there's a belief in this by the system, by caseworkers in a case working with a particular family, that if they were able to provide certain services, they could avoid the use of foster care. Now, what we know is from HHS officials' testimony to the House Ways and Means Committee, as well as the program instruction that they put out recently, they are going to give states a lot of flexibility to define what this means for themselves, especially the concept of imminent risk. And we think that that'll be interesting because it could lead to lots of different interpretations by states. I guess the strictest view, for example, of imminent risk might be that this only applies if a family has been substantiated for abuse and neglect. A less strict view might be that if there was a single report or maybe multiple reports, even if they were unsubstantiated, that might qualify for imminent risk. And states are going to have a lot to say about how they define that for themselves. A second question, what will get cleared? The one big piece of this puzzle on the front end of Family First is that you can't just pay for any type of substance abuse service or mental health treatment or parenting skill. It has to be a model that is listed on the Family First Act clearinghouse, and that is in the process of being built. That contract went to Abs Associates, so they will be putting that out. We're assuming sometime relatively early in 2019, and they have already begun and have announced the first 12 models of programs that they will be reviewing, and that was put out as like a kind of an addendum to the program instructions that HHS shared with the field recently. So if you look at that bottom link there, if you click on that, you can get to our story where we sort of outline all the different models that are going to be in that first wave that get reviewed. Just a couple of quick takeaways that we thought were interesting. There seems to be quite a focus in the mental health basket here on adolescent behavioral health. If you look at the sort of framework and concept of the Family First Act, you might assume that the priority as far as the mental health realm would be to stabilize a mental health episode experienced by a parent. But clearly, if you look through the models that they've listed, and again, that's listed in our article as well there with that link at the bottom, you see that they are going to be taking a hard look at inclusion of services, mental health services that seek to address adolescent behavior in particular. Home visiting, which we'll talk about a little bit more in a second, was another big winner. All three of the parenting skills models that were approved are home visiting models. And I think probably maybe the most interesting thing to me when I saw this list was that they are considering for inclusion methadone treatment, a methadone treatment system. And what that says to us is that they apparently are going to take a fairly broad view of what types of things might be included in this clearinghouse. It will not be simply things that pertain directly, very directly to child welfare. Third question for us, and this is where we get to a little bit more about home visiting and other programs, is how do voluntary models fit into this whole thing? Like I said, 3 home visiting models made it into that first round of consideration: Nurse Family Partnership, Healthy Families America, Parents as Teachers. They and many other home visiting models and many other programs in other realms operate on a voluntary model. It's insisted upon in the model that this is not something that a parent has to do. It's an optional thing that they choose to do. Now, the structure of Family First sort of establishes that if it's coming into play, you're in a situation where the services rendered are the thing preventing the system, the caseworkers, from using foster care. And so I think it'll be interesting to see how that construct meshes with the idea that a parent has to take up the idea or opt into something like home visiting of their own free will, not in a coercive structure. Now, I've talked to several officials at different home visiting models. I heard from one who was pretty confident that it's not going to be a problem and that home visiting meshes pretty well with Family First. I heard from another that a big part of this is going to be how states define candidate for foster care and imminent risk. So that's a big TBD for us. And question 4 on our list here is, can states downsize congregate care? I'm going to shill real quick for a project that the Chronicle did over the summer called the Who Cares? A National Count of Foster Homes and Families, where we really dug in, collected federal data and state data to try and get a decent assessment of what each state's foster care capacity was. Where are kids living once they're removed? How are states doing in terms of recruiting new foster homes, as well as how much are they relying on kin? What we found here through the data that we obtained is that 31 states have placed a higher percentage of foster youth in these congregate care placements in the most recent federal data, so from 2016, than they did in 2012. So as we're moving towards a law being on the books that is going to, attempt through federal limitations to, push states, encourage states, I guess, to downsize the number of kids that are in congregate care, we're seeing those numbers go up. And so this is going to be a critical part. Obviously, states that are not currently relying or using congregate care a lot are going to have an easier time taking advantage of the front end funds that are available through this act. And for those who need to downsize, the question becomes, what do you do to get there? are there effective ways that you can recruit and retain more foster parents? Many of those, it's likely that as you move more kids away from congregate care and start relying more on family settings, you're going to need some of those to be clinical. You're going to need a lot of them to be clinical. So we could see a rise in the demand for things like therapeutic family care. If you want to take a look at some resource that kind of highlights how 3 different counties in New York handled downsizing congregate care recently, we put a link to a report from Red Lake Horowitz, which is one of our funders, who did a really good job just sort of outlining how a couple of different fairly large counties in New York State have gotten into this issue. This slide here just gives you a little bit of context on some of the findings that we had from the Who Cares report, which, by the way, I think we link to it later. It's fostercarecapacity.com is where you can find all that information. And so with that, I'm going to move over. I'm going to let Daniel take the last few questions, and I'll run the slides for him while he goes over our 3 other questions.
Okay, thanks, John, for the rundown. Now, I mean, I see that the chat is kind of blowing up, so if you can go in there and start dropping links in, that'll be good. But that was a nice overview. I think this question 5 is how will states support kin, or will they, is really critically important. We just came off of a tour of, we were in LA, Georgia, Chicago, and DC, talking about foster care capacity to coincide with the publication of our report, Who Cares, which looked at that nationally. You saw those numbers. We continue to rely on relative caregivers, many of whom do not get the same payments as non-relative foster parents. And in Family First, this sort of second-class citizenship of kin caregivers was codified into law. You will remember that when kids, when a family is in imminent risk of losing their child, they are now eligible for support, whether that's substance abuse, parenting skills, or mental health services. And I'm sorry, I'm in downtown Los Angeles, so you're always going to get sirens. So when they, the way it's written, it says that, while the parent is getting treatment, they are going to be, where is the child going to go? And it assumes that they're going to go with relatives, and there's no consideration for those relatives. So I think that in a place, if people are looking for places for advocacy, I would think that this area, equalized payment for relative caregivers and equal consideration for relative caregivers, is going to be a very important one. It's definitely something we are going to be looking at in 2019. The one kind of bright spot clearly is this kinship navigator issue that John brought up earlier, and that now, as long as it's evidence-based, you can get a match on it, which could presumably expand kinship navigators, which is very important. So you can see from this slide, just green means that they're relying on kin more everywhere in the country, basically, except for Alabama, South Carolina, and Kentucky. You have expanded reliance on relative caregivers. So, this is without families, the child welfare system in America would be in disarray, and families are still treated as differently than non-relative foster parents. And that's something that I think the system has to really look at, and that Family First really highlights the need to look at that more clearly. So that's my thoughts on kin care. Future of waivers, I just had a story out about this. You will all recall that Title 4E is a open-ended entitlement, Title 4E of the Social Security Act. In 1996, there was legislation passed with the hope of testing out strategies to improve the child welfare system, very specific strategies called the Title 4E Waiver Demonstration Project. In subsequent reauthorizations, that has turned into essentially states or jurisdictions taking on a capped allocation, so sort of like a block grant, in exchange for flexibility in how they spend their money, and the ability to capture those savings and use them on different programs and try to improve the system that way. There is LA County's Department of Children and Family Services has been trying to band together a group of different jurisdictions to try and ask for an extension of the waiver. The waiver will expire September 30th, 2019. October 1st, 2019, Family First becomes the law of the land. Those waiver jurisdictions, I've heard from San Francisco saying that they like the flexibility. Los Angeles County will lose money. The city of New York City is definitely looking at whether or not that's something that they're going to advocate for on the federal level. You know, Ohio is a state with many waiver jurisdictions. So there is a lot of fear about what losing the waivers will do in terms of money and flexibility and how money is spent. So you can read my story from today, which goes into where that whole effort is at. And I can't prognosticate on what will happen, but you should read that story because I think it kind of puts it into context. Okay, question 7, John. Will states go for it? So in early November, jurisdictions were supposed to report to the federal government about whether or not they were going to take a delay in implementation of Family First. Remember, taking a delay means that you're dropped into, you know, if you take a delay, you don't get access to the prevention services money, but you also don't get access to, you also are not beholden to the heavy restrictions on congregate care. So who's going to delay? I know that Florida and New York have sent in letters to delay. The state of California has not made a decision. Of course, this all came at a strange time. You have new governors coming into many of the states. So to kind of make a decision on whether or not you're going to push back your implementation of this new kind of sweeping federal policy, it's a kind of hard time to make that decision. In Georgia, which, you know, the child welfare director there is amped on Family First and wants to see it implemented, but because of the kind of computer systems, et cetera, it's going to take a year to do it there. John has been talking to folks, and he's hearing that about 12 states are considering, you know, immediate implementation. We have requested of HHS to tell us what people are saying. They have not complied with that request, so John has gone forward and issued a FOIA request. So we should know a little bit more, and I'm sure there's 110 of you on this call, so maybe some of you know if your state has wants to delay or go for it right away. I think it's a big question, and one, you know, that can have big consequences. If you go for it early, then presumably you're in the conversations about what services will be allowable under the law. And if you wait, you might, you know, where does that leave you in that whole process? So those are questions I don't know the answer to, but I'm sure somebody on the call does. So with that, we hit the next slide, John, because I think we want to hear from folks. So, you know, what is uncertain to you about Family First? What excites you or concerns you about the law's changes? What are you hearing about state or local impact? Questions for us? You know, we just love to hear what people are thinking about this federal law and really the largest change to how foster care is financed since the federal government got into this business of child welfare. So there's a lot to talk about. Please keep any kind of thoughts under a minute so we can get to as many people as possible. So
yeah. So thanks, Daniel, for all that. And I'm going to actually just kind of stop sharing the screen because it's a little easier to toggle between the Q&A and chat while the whole thing is open. So I think what I'll do is try and kind of go back and forth with there's two kind of avenues to get comments in here in the chat section as well as in the Q&A. I guess let's start with the Q&As here. One question we got from Julie is, would shelter housing homeless pregnant women and their housing services qualify? Would shelter housing homeless pregnant women and their housing services qualify?
John.
Yeah. So a lot of these, I'll have to just give my educated best information to you here. And I guess, and if people want to chime in and tell me I'm nuts in the chat room, I'll also do my best to correct if I'm wrong. But my assumption would be that shelter housing homeless pregnant women would qualify for it. I don't know. I mean, I think that's, if you could make the case that was a situation that fell in underneath the three kind of frameworks for the prevention services, I guess you could. But I think it would have to be a model that sort of comported with one of those three things. I'm just going to try and rip through more of these. No Sherwan Yassin, are there recommendations of frameworks, models, metrics, or elements to use when looking at discharge, post-discharge requirement aspects of Family First? I don't believe that they are to that point yet, where there's, what's basically happened as far as the clearinghouse goes, if that's what you're asking about, is they have sort of asked for feedback on how they should evaluate things. What should be the rubric through which they look at what to include and what should be the priorities to review. And they have, started to, and then on the other end, they're sort of looking at, okay, well, how once this all gets started, are you going to evaluate impact? And I think that stuff is still very much in the air. I had a question, how can we download the slides? We will figure out a way to get the slideshow to everybody that registered.
Hey, John.
Yes.
We got a concern here. Current list of 12 do not include programs with higher relevance to child welfare specifically. Yes, that is a concern. I mean, I think that remember, Family First was passed in a continuing resolution that committed the federal government to $300-some billion in spending, and it was a budget neutral provision. And part of achieving budget neutrality was creating some very tight parameters by which a program could be eligible for funding. So you have these high evidence-based standards for substance abuse, mental health, and parenting skill classes. You don't really have, when you're looking at a substance abuse program, the answer about whether or not it works is whether or not there is a relapse. It's not about whether or not a child is maltreated. So, a critique of the law could be that it was built on an assumption, was built knowingly that you don't really have much of an evidence base, and it calls for an evidence base simultaneously. So yes, that is a concern. It will be, I saw another question from people asking about academic institutions, what they could do to kind of gird themselves for this law. I mean, I think that, as the dean of a prominent school of social work once said, this is the Social Work Researcher Employment Act of 2018, because the thing to do is try to now evaluate at breakneck speed to try to find interventions that will actually avert child maltreatment and prevent entries into care, which we don't really have a huge amount of information on.
Yeah, and I think, again, going back to the inclusion of those models, I think that it's clear. I think that the inclusion of methadone assisted treatment makes it clear that the approach that is being taken currently by Children's Bureau and by APT and people that are implementing this is to say that this law is not simply it is a child welfare law with implications far outside of that realm. we are going to consider things that are not gauged by their child welfare impact specifically. We're taking the proposition that if a mom gets methadone treatment and that is effective in helping her to get clean and not relapse, that is in and of itself, you know, an instrumental part in preventing foster care, which in and of itself then would be, you know, a child welfare outcome. I think this also plays into something. We got a question from Sarah O'Rourke, and this is something that I put up a column about this week. A big question we're hearing is who will be the payer of last resort as Title 40 dollars become available for new services that Medicaid, other funding streams may have paid before. And this is like a super wonky part of this whole thing, but it's pretty important. As the program instructions are laid out that HHS shared recently, 4E prevention services, so the Family First Act front end money, is the payer of last resort, so it is in line behind Medicaid, which means that if Medicaid can pay for something, then it is the preferred, it is the thing that should pay for something. That 4E prevention services would fall in line behind it in the hierarchy and only fund things that other federal programs or private insurance wouldn't pay for. And so I've already heard, and that's why I kind of put something out about it, that's a much more complex framework than letting states, for example, decide which one to use. Now, I think given the option, if something was available through Medicaid in your state for the first couple of years of this act, most would, just for fiscal purposes, would probably choose Medicaid because it's a higher match. Family First until 2026 is a 50-50 match on the front end services, and then it jumps to the Medicaid match rate. You know, so I just for fiscal purposes, I think that would be preferential in some ways. But not all state Medicaid plans are created equal, and some states have a fairly robust array of things approved for mental health or substance abuse treatment under Medicaid, and other states do not. I'm going to throw it to Daniel in a minute. He's excited about a question here. But just to kind of wrap that up, I think it's actually kind of creates a situation where it's the states with less robust Medicaid plans that may find the offer of Family First a little bit more attractive. Daniel, what'd you find?
Oh man, this is good. I mean, it's like it's coming so fast. I mean, it's amazing. But so I can't even read the whole name, but it's an EST ... But it's maybe an ester, I don't know. But if many states don't opt in now, do you think we would have an opportunity to pressure HHS to allow states to first implement prevention services in an effort to reduce overall number of foster care entries, thereby reducing the need for congregate care and making the shift in congregate care requirements more doable? Well, okay. That is how one would have legislated policy that would have had a chance to not create what is an inevitable crunch on the back end. So I don't know whether or not if enough states don't opt in, that'll create an opportunity to implement prevention first and then get to the congregate care requirements later. I mean, I think that on the back end, invariably, you know, you're gonna have, I mean, Family First offers $8 million for foster parent recruitment or retention over the next 10 years. It's not very much money. California over 4 years spent $120 million, so you do the math. But you've got this, you're gonna have a problem on the back end of stepping kids down and finding placements for them. I kind of think that non-relative foster care is going to become the new group home in a sense. You're gonna have higher need for therapeutic foster homes, and you already see that the new rules are trying to ease standards so you can put more kids in foster homes, okay? So that's what's happening in the wake of Family First. And then in terms of this idea of pressuring HHS, I mean, the question to all of you, I think, is what do you push for now? I mean, Family First has forced, I was talking to somebody in Ohio, has forced a grand reckoning with what the system is and how to design it. It was created under incredible strictures and pressure that make it hard to see it realizing its full promise. So there are opportunities. I think that, pressuring HHS and the legislature for, and this is not something I'm not involved in pressuring people, but I think that that's totally a reasonable thing to do. I think that would be reasonable. That's a reasonable approach to reducing reliance on congregate care and the system, is to actually reduce entries. And to do them simultaneously is making a big assumption that it's all going to work in a millisecond.
Yeah, and going back to something that we covered during the congregate care question, I think that makes it eminently more doable for the states that already have a low percentage of kids living in congregate care right now. And then kind of further, somebody kind of pointed this out to me at a conference I was at recently. It's actually the question that a state should look at to kind of gauge the impacts, or anybody that wants to look at what their state's, the impact of this on the congregate care in their state would be, is try to find the percentage within your congregate care population that is actually 4E eligible kids, because 4E does not cover under Family First. The front end provisions are going to be for any kid or any family. There is not an income test attached to that. For payments to support foster care, there still is an income test. It's tied to AFDC 96 income levels and all that. And so that certainly does not cover, especially as we get further and further away from that year, all the families in the system. So that's the real question. Two ones I want to talk about. A quick one, I can get this done real quick. The question from Iana: can states create their own evidence-based programs and send TAPS associates for consideration? Not only can you do that, but they have, I believe, have prioritized things submitted by states or counties to consider. Here's one, Daniel, from Shanti Ezreen. So what are the opportunities for states to support kin families when these kids are placed with them, since Family First services only support the parents? What can states do to support kin? So to be clear on something that both of us had talked about, the Kinship Navigator program, this is something that has had a relatively small allocation of federal dollars to help that field grow in recent years. And just for the uninitiated, a Kinship Navigator program is somewhere where relatives are going to be able to get counseling. Some get direct services. Some mostly operate to refer relatives to other things in the community that they may be eligible for to help them take care of kin. Now, the Navigator, what this sets up is a chance for pretty significant investment in that from the feds, but only if there are evidence-based kinship navigators. And right now, as of today, there is not one that meets that threshold. The models that APT are considering or will review include two different kinship navigator models operated by Children's Home Society of America branches. One is in Florida. I have heard that that's the one that's got like probably the most potential to gain that evidence-based tag. And so if you're looking for one that's going to possibly, get replicated around the country anytime soon, I think that one has a decent chance. But, putting aside the Kinship Navigator, this is absolutely a question that advocates and people in different states should be talking about with their legislators, because the kinship arrangement that Family First envisions here is something that states are already doing a lot of, and we just don't talk about it in the same way that we talk about foster care. Mm-hmm. This is the idea is mom needs to go get help. She may need to have the child live with Aunt Susie for a while, but we're not going to call it foster care. We're going to say that that's part of this construct of Family First. And in a way, that's really codifying what a lot of is happening already. And so I guess the half full glass approach to looking at that is it's already happening without the offer of services that are available under Family First. And so now you're giving systems a better chance to work with those parents to get that, to stabilize the situation and get the kid back home and out of the relative's home. The other way to look at it, though, I think Daniel's going to expound on right now. Go.
Well, yeah, I mean, yes. I look. The fact of the matter is there. You know, relatives are getting short shrift across the country, and if you don't, you know, in that construct, as John said, it's codifying a shadow system. So, you know, family first, you know, mom is getting treatment. That's great. That is good. That's a positive thing. You know, it is a huge step forward that now the Title IV entitlement, the benefit has been conferred to a new class of beneficiaries, parents whose children are at acute risk of entering the system. That is a huge shift. As one Hill insider told me, it's a double unicorn. It's an expansion of an entitlement, and it's an expansion of to a whole new class of beneficiaries, okay? Double unicorn, so that's good. But for relatives, it doesn't do anything. I mean, you know, and so what you can do as a state is you can draw down TANF funds, so, you know, block granted welfare funds. You know, you can hope that the state coughs up some dough on this. In Georgia, they've got some really interesting idea. I've got no idea if it's going to work, and maybe somebody who's smarter than me can tell me. But, you know, the front end is all about family preservation. So what if you redefine family preservation as the family, not just the parent-child situation? And then you could draw down prevention funds for relatives through that. I don't think that that's the way the law was done. But I will point out that, you know, sometimes you have like time bombs in federal policy. So in Fostering Connections, the 2008 Act, they had a provision that said, when they wrote the law, they said now kinship care placements can get matching federal funds to pay for those kinship care subsidized guardianship placements. You know, but the Children's Bureau wrote the law prescriptive of the passage of the law. So that meant that only agreements that were entered into after the law was passed could be eligible for federal funds. You know, took some pressure, they changed that guidance. All of a sudden you had lots, it blew up the score. So, you know, the things are scored, you know, the Family First was scored as budget neutral essentially. But if you could do a trick like that and make family eligible for prevention services, blow it up. I mean, I don't know if it's really fair to pay a non-relative foster parent more than you pay a relative foster parent. In California, you don't do that anymore. And a lot of, you know, in some states, you just don't do that anymore. But Family First, like, takes us back in that sense. There was one thing, this Robin, who's, you know, talked about pressure earlier. I think pressure is a good word, but then or Esther Sherrard. Esther Sherrard, I just left my job at the Children's Bureau last month to work with a nonprofit aimed at foster care prevention. Would love to connect with you. We have so much data to inform all of this, and it's frustrating that HHS is not using. I think Milner would respond to data-informed pressure. So I like data-informed, and pressure sounds pretty good too. So anyway, sorry, it's exciting.
Yeah, this is great, you know, and I think that I don't want to bang too hard on HHS here. I know that they, like every federal agency, need to be cautious, but you know, the reason that we went ahead with a FOIA request to obtain this, the names of these states, is because the discussion on something this major, especially since it was kind of passed, you know, very quietly as part of a bigger spending bill, like as we move closer to this, should be a very public thing. It is. Obviously we have a bias as journalists, and of course we're going to think that way. But you know, this conversation needs to be public. It needs to involve a lot of different people with a lot of perspectives, and so, you know, we think it's pretty relevant which states were, you know, wanted to chime in early and say something about, you know, their concerns. So the question here: how do you recommend academic institutions or research centers positioning ourselves? Not sure this is where you were going with it, but I'll just talk a little bit about, you know, one big part that academics and research centers are going to play in this is evaluation, both of candidates for inclusion on the clearinghouse list, and then eventually evaluation of whether services under Family First are having an impact in preventing, further use of foster care. I think one big open question, we didn't include it because we couldn't include every question we're looking at, is there money available under Family First to pay for the level of evaluations, the kind of rigorous stuff that they're looking for inclusion? And I think I think I breezed by this earlier, but basically for folks that are just coming in on this, there's 3 levels of evidence base that can be considered for inclusion on the clearinghouse. Promising practice being the least supported, and then well supported. And you have to spend under the Family First plan 50% of your Family First 4E money on the prevention plan on that well supported tier. And this is going to take more evaluation of more programs over time. The cost of doing that is significant. And so I think a lot of people in the research community that I've talked to are wondering how the federal government envisions the act helping to support that effort. I think that one kind of thing that we'll be looking into is whether the administrative costs portion of Family First, so the willingness of the feds to support and share costs on admin, is extended to include the cost of evaluating programs or for consideration or tracking them after they've been done. Daniel, see anything that's catching your eye?
Dude, there's so much. Okay, what is Ben Gibbs? Hey, Ben. Related to income tests that still exist for actual foster care reimbursement, would you say this creates a fiscal incentive for states to support 4E non-eligible children through in-home services and not place them in foster care? This seems like a stronger move towards family preservation than something else. I don't know what that is, but anyway, yeah, I mean, it is crazy in Family First. Another big thing that Family First did was de-link the front end of 4E, this new benefit. So you've had since 1996 you've got this 1996 poverty standard to determine eligibility. I mean, think about the waiver jurisdictions that don't have to do this crappy eligibility figuring out thing. So Family First got rid of it on the front end, was supposed to get rid of it on the back end for adoptions, but then decided to keep it for a little bit longer to save some money, which is a little bit shady, but then keeps it in the middle for placement. So yeah, I think it's an interesting question. If you don't have to deal with this eligibility requirement, it's open, maybe that does result in way more attention on the prevention side, because you just, it's easier billing, you can bill more, your penetration rate's 100%. So that seems sort of, that seems like, yeah, that is a big move towards family preservation in my mind.
Yep. So Florida, another question out of Florida, and I can't read, I apologize, to the Florida Institute of something. It's shortened in our screen, but question is, do states who delay ever have the opportunity to gain prevention funding in the future of FFPSA? And the answer is definitely yes. I mean, states will have the opportunity to seek up to a 2-year delay. And unless something changes in that time, they will all have to comply with the congregate care limitations as of 2021. And as soon as that happens, they will be eligible to submit a state plan for approval to use the 4E front-end prevention funds. So it's not the case where if you're opting out now, it's not use it or lose it. I would also point out that look, if we get to October and 12 states have opted in, or who knows how many different states have moved on Family First, I think the recent history would tell you that it's pretty typical when there's optional stuff on the table for some states to jump in and most states to kind of see how it goes. If you look back 10 years from now to the Fostering Connections Act, that act didn't have this kind of structure of front end, back end that Family First does, but it did offer two optional things to states. You could take up federal reimbursement for kinship guardianship programs. So you could also extend your foster care system to include 18 to 21-year-olds. And there was a lot of excitement about that when it happened. At this point, you know, we have the majority of states have opted in at least to the structure of doing that. I think it varies, you know, from state to state how much they actually do both of those. But, you know, in those first couple of years after Fostering Connections passed, you know, there were very few states. It was a real trickle in, followed by, more recently, a large number of states kind of rolling into that. Daniel, I could see you looking hard at some questions here.
I mean, it's just,
I'm going through the same
like,
as Tom.
I've got a question actually for the group. I don't know how people can answer this, but so Fostering Connections 2008, that's the last like major federal child welfare reform. It offered, as John's saying, two optional things, you know, extension of care money and relative caregiver money that some states opted into. Not Family First is not an opt-in type situation. I mean, you know, sure, you can delay for 2 years, but this is it. So so it's a different dynamic, and you know, I've seen more resistance to Family First. You know, there's a lot of course, celebration and a lot of like happiness about it and all that stuff. But I've seen a lot of concern, a lot talking to people across the country, and I just wonder, to the degree people are going to be, to the degree people feel like it's done, like finance reform is done in child welfare, or if they think that there's opportunities to go further and do more. I'm really just curious. We've got, you know, more than 100 people from around the country, and I just wonder, smart people who are probably working on this stuff and care enough to tune into a webinar on Family First, I just wonder if there's going to be, what are the new pushes going to be? And maybe that's something you can email to John and I, but where are we going? You know, is this it? It's my question.
Yeah, and like Daniel said, we wanted to do this both to try and get to as many questions as we knew the answer to, and to kind of let you know like what we're working on here, and what some of the things that we're paying attention to. But we love feedback. We really would love to hear from everybody on here, kind of about what they're seeing. If you read something that we put out there and say that's crazy, here's what's really happening on the ground, we love that info. We'd love to hear it. So again, my email is jkelly, that's JKELLY, at our website, chronicleofsocialchange.org, jkelly@chronicleofsocialchange.org. Here's a good one that I hadn't really thought about much. There's a comment here in the chat. It says the other issue we've run into is that since the federal money goes straight to DCS, the state legislature has had very little power to have any oversight over the operation. So apparently Arizona DCS waived out of Family First for the delay without any discussion with the legislature. I think that's an interesting thing that we really haven't gotten to yet, is whether or not some of these state legislatures who are hearing it back home about rising, in some of these states, about rising, rates of opioid deaths and increases in foster care. What are you going to do about it? I think that they'll be surprised to find that maybe some of these agencies are moving and making decisions for themselves without really checking in before they do that, or weighing in. Daniel, what's up?
No, I just see Ben has a thing. It seems like a logical next step would be to drop income eligibility from foster care reimbursements altogether. Is this feasible at all? So, okay, if I talk to anybody, if I'm at dinner with my wife or my uncle and I say, hey, guess what? You know, to be eligible for federal foster care reimbursement, a kid's parents have to earn less than the federal poverty standard from 1996. People look at me like I am crazy. I think that we have struggled to tell that story clearly because it is so befuddling and stupid. I think that John, who would probably say, I mean, the most straightforward to do that would be to drop the reimbursement rate and get rid of that eligibility requirement, which in of itself would save millions upon millions of dollars and put a lot of these consultants out of work who deal with eligibility. But I mean, the other thing is like, so like with the kinship care thing, which is like a plainly senseless, this is even more plainly senseless. So I think that, I don't know how this field lives with something like that. That the fact that a biological parent has to meet this arcane federal eligibility requirement when you're talking about, you're talking about, the well-being of children. I mean, it doesn't matter if you're rich, poor, whatever. Like, what is this crazy thing? So, as a field, you got to ask yourself, what are you going to do? And that seems like a place where there's good storytelling for us, but good advocacy for other people.
Yeah, and so like to be clear on one thing, Daniel kind of referenced with me there is the sort of within the constraints of general procedure in Congress, right? The way that you would try to get rid of that income threshold would be to say, okay, we're going to support through 4E foster care any child who is removed and placed into foster care. But to make that cost neutral to some extent, we're going to take down the actual match rate of the federal part of that. That way you could level it out. Now, on the one hand, I mean, if you were to do that, it would prepare you for a situation where if there was a heretofore unforeseeable uptick in kids coming into care, you'd be in a good position as the match would continue to cover more and more kids. I have heard that the biggest downside to just kind of rejiggering the match rate to cover everybody is that wouldn't hit every state the same way, right? So there would be some winners and losers in that, and politically that gets thorny. But I would encourage everybody to read Daniel's op-ed from I think 2 weeks ago now, which basically says that's the political discussion that would probably have to happen now about how to kind of do it within the pay-go era of child welfare. And the other side of that is, are we capitulating too much in the child welfare realm that there shouldn't just be more funds available, and that shouldn't be part of the discussion a little bit more.
Hey, JK, I think we're going to have to wrap it pretty soon.
Yeah.
Right?
Yeah, so it's looking like it's about the clock. It's about to strike 2 on us. So let's do this. We've gotten more comments than we've been able to address here. We will over the next day or two do our damnedest to just get back to everybody that put in a comment here. And like I said, if you want to contact us directly, Kelly at chronicleofsocialchange.org. And so with that, I guess we'll close it out here. Daniel, any further thoughts?
Well, Esther, and I can't see your last name. Let's get a think tank to discuss together to discuss more reform. The door was just cracked open with FFA, so should we take advantage and go further? Exclamation point. So yeah, I mean, I think that there's a lot of opportunity. I think that you should all see the Chronicle of Social Change as trying to be reflective of the views of the field. So if you have ideas that you want to share with us, please send them our way. And then also know that we are, there's a submission process. If you want to submit op-eds, opinion pieces, we'd love to see that. And if you've got any guidance, on the next thing we can tackle on a webinar or whatever else, we're happy to do it. One last thing I will say is we are right now a part of something called Newsmatch, where every donation is tripled. So you've already done that by joining us and helping us out that way. But if you believe in what we're trying to do here and you got a little bit more, anything is tripled. So, and that shuts down December 31st. Beyond that, I love all these comments. I want to answer them all. I would like to talk for 3 more hours, but everybody's got work to do.
All right, guys. So again, we both want to thank you from the Chronicle of Social Change for hitting us up, supporting this webinar. Like Daniel said, we will certainly, the door is open for us to do stuff like this again. So if you have thoughts on, how we can better inform the field or foster discussion, don't hesitate to contact with us with that. Excuse me. So everybody have a great Thursday and a great holiday season, and thanks again.